Ontario's top doctor says cases of flu and RSV across the province are on the decline, while COVID-19 remains a problem. Dr. Kieran Moore says key indicators are showing signs of improvement. Those trends are being seen right here in Hamilton. Matt Ingram reports.
Almost 3 years after declaring COVID-19 a planet-wide health emergency, tomorrow the World Health Organization will decide if it still is.
While I will not preempt the advice of the emergency committee, I remain very concerned by the situation in many countries.
Whatever the WHO declares, it really technically will not change our approach in Ontario.
Ontario's Chief Medical Officer of Health says COVID-19 hospitalizations are trending down, and the number of COVID patients in the ICU are the lowest they've been since last summer.
That absolutely has been trending in the right direction. I am concerned, though, about XBB.
Moore says while the XBB.1.5 variant, also known as the Kraken, is not associated with a higher risk of severe illness, it is known to be more transmissible.
We could anticipate an increase in admissions to hospital as a result.
But he's less worried about the potential strain on our overworked healthcare system because he says RSV cases are starting to decline and the flu season ended much sooner than usual, adding that since these two viruses can send children to hospital, health workers may soon be able to make headway on the large backlog of pediatric surgeries.
We have hope now.
St. Joe's Hospital infectious disease doctor Zane Chagla agrees more capacity for pediatric patients will help, but he cautions clearing the backlog will take time.
It's much harder to actually catch up.
Chagla says flu cases have plummeted in Hamilton.
There's a lot less influenza in the hospital than I think I can remember at this point in a given year.
He sees RSV starting to decline too, but says it's still leading to child hospitalizations.
It is definitely better than a couple of months ago, but still an issue.
Chagla says COVID-19 poses a moderate risk right now in Hamilton.
It seems based on our numbers a little bit more activity than kind of earlier in January, but certainly, not a significant spike.
Our case counts are down. Our wastewater data indicates that it's trending downward. And likewise, our test positivity is trending downward.
Jordan Walker from Public Health says there's still moderate COVID-19 activity in Hamilton. The city says the risk of COVID-19 and flu transmission is decreasing. RSV is not reportable to Public Health, so it doesn't track those numbers. Dr. Moore, Dr. Chagla, and Public Health say while this all sounds like good news, we should still be cautious about catching a respiratory disease, especially as the XBB.1.5 variant spreads and our health system recovers from the burden of the pandemic.